Good morning everyone. Today's topic is Introduction to Removable Partial Prosthodontics. I am Dr. Saravanan. We'll see about the definition, the types of removable partial denture, their indications and their various classifications of the removable partial dentures. First definition. Removable prosthodontics is defined as a replacement of missing teeth and supporting tissues with their processes that is designed to be removed by the wearer. That's called the removal processes. And the classification, we have two types of RPDs. One is entirely tooth supported RPD, and another is both tooth as well as tissue supported RPD. Okay. Next, we go to the indications of removable partial denture. Most common indication is removable partial dentures are preferred for longer edgeless spaces. Unlike FPD, the removable partial dentures can take support from the tissues all along the ridge. Also, RPDs help to distribute the forces around the ridge evenly. So in such conditions, fixed partial dentures are contraindicated, and in such conditions, removable partial dentures are more commonly indicated. Next common indications is in young patients, because the FPD is contraindicated because they have a larger pulps and lack sufficient clinical contact. So in such conditions, we can go for a removal processes. And also a postgrade is required for the fabrication of fixed partial denture. When it's not present, then the only choice is the removable partial denture. Also, when the parental support of the remaining teeth is very poor, a fixed partial denture is contraindicated, then most commonly a removal process is indicated. And in patients with physical and emotional problems, a removal process is more commonly preferred because time needed for a removal process is very less, shorter. Also, it is more economical than a fixed process. These all are the indications of a removable partial denture. Next, we go to the need for classification. Why we need to do classification? Classification is done to formulate a good treatment plan, to anticipate the difficulties commonly to occur with that particular design, and to communicate with a professional about a case, and to design the denture according to the occlusal load usually expected for that particular group. These all are the needs for the classification. What are the needs for classification? Okay. And a classification, whatever classification is given, must follow the following norms. It must allow visualization of the type of partially edgeless arch, allow differentiation between either tooth and tissue supported RPD, serve as a guide to the type of design to be used, and classification must be universally accepted. Based on all these requirements, various classifications have been proposed, but the most commonly and most accepted classification is the Candice classification. We'll see in detail about the Candice classification. Dr. Edward Kennedy of New York proposed this classification in 1923. He has given 4 classes: class 1, class 2, class 3, class 4. Coming to class 1. Class 1, it states that bilateral. Bilateral means both the sides. It's edentulous. Edentulous means tooth is absent. It's bilateral edentulous area located posterior to the remaining natural tooth. Means it's located posterior and it's located bilaterally. Okay, that's called class 1. Next, we go to class 2. Class 2 is unilateral edentulous area located posterior to the remaining natural tooth. That is class 2. Next, class 3. Edentulous area located with anterior located both anteriorly and posteriorly. That's called Candice class 3. Class 4 states that single but bilateral. Bilateral because it crosses the midline. Crossing the midline located anterior. It's located anterior to the remaining natural teeth. That's why it's called Candice class 4. These all are the Candice classification. Next, applicates modify the Candice classification based on the condition of the abutment to include 2 more classifications: class 5 and class 6. Class 5 states that edentulous area mounted anteriorly and posteriorly by natural teeth, but in which the anterior abutment, that's the lateral insert, is not suitable for support. Okay, but class 6 says that edentulous area in which the teeth adjacent to space are capable of total support of the removable partial denture. That is Candice class 6. Applegates has given certain rules for classifying a given condition. The 8 set of rules. We'll see one by one. The following rules should be considered to classify partially edentulous arches based on the Candice classification. First rule states that classification must follow rather than precede extraction. That might alter the original classification. That means classification must be done after the extraction of the given rule. Okay. Second rule states that if the third molar is missing and not to be replaced, it is not considered in the classification. It's pretty direct. Okay. Third also is direct. If the third molar is present and is to be used as an abutment, it is considered in the classification. It's pretty direct rule. Okay. Fourth also is direct rule. If the second molar is missing and is not to be replaced, it is not considered in the classification. And the most important one is the rule number 5. Always, see the diagram, always the posterior most edentulous area, that's the posterior edentulous area, determines the classification. It's the most important rule in the before classifying a given condition. Although edentulous area is present anteriorly, upon rule number 5, the posterior most edentulous area always determines the classification. That must be kept in mind before classifying a given condition. Okay? Rule 6 states that edentulous area other than those that determines the classification are termed as modification spaces and are designated by their number. Rule number 7 states that the extent of modification is not considered, only the additional number of edentulous areas. And rule 8 states that there can be no modification areas for classified arches. These all are the rules before we classify a given condition. Okay. Next, we go to the advantages and disadvantages of the Candice classification. First, advantages. Allows immediate visualization of the partial edentulous arch. We can readily relate to the arch configuration with the basic partial dentures system to be used. Permits a logical approach to the problems of design, and it makes possible the application of sound principles of partial denture design. Coming to the disadvantages, whether maxillar mandibular arch is not mentioned, occlusal relation is not shown, the number of missing teeth and the number of abutments are not told, additional edentulous areas are not described, extent of edentulous area is not known, and finally the condition of underlying tissues is not mentioned. These all are the disadvantages of the Candice classification. This completes the class. Thank you.